right. Welcome, Nancy. It's good to have you on the podcast.
So great to be here. Thank you so much for having me.
Yeah, it's great. It's good for us. So we appreciate all the work you're doing,
Thank you.
obviously. But before we get started, I like to give the listener a sense of who the person is behind the big CEO title. So if we can do that with you as well, where were you born and raised, and sort of what was your path to American Heart Association?
Sure. Well, I was born and raised in a small town in Michigan called Marysville, Michigan. And, you know, an amazing community filled with people who really cared about the community and cared about, you know, making a difference. And so I had those values from early in life, so it was not difficult for me after college to recognize that I wanted to go into work that built upon my marketing background, which is what my degrees have been in, but also allowed me to really think about how I could use that expertise to help people. So my very first job, besides internships and things, was at a hospital in Detroit, where I did fundraising and marketing. And boy, I got addicted to fundraising. I loved it. It was amazing. So not long after that, I found my way to the American Heart Association and have had now an almost 38-year career at the AHA.
Wow.
Yeah.
And where did you go to college? You go to college
Central
in Detroit?
Michigan University.
Okay.
Yep.
Is that in Detroit or outside
No,
Detroit?
it's in Mount Pleasant, Michigan. So on the way up to Traverse City, where I know you have been before, on the way up there, it is a great school, had a wonderful business school, wonderful marketing program, and you know it was a wonderful experience.
That's great. So what took you again to the local affiliate of AHA in Detroit?
Well, I was working at the hospital and the local American Heart Association, and at that time, you know, we're talking 1986, right? So at that time, the American Heart Association had 56 separately incorporated affiliates and then the national organization. So at that time, the Michigan affiliate was looking for someone to come and lead their fundraising programs for the state. I was hired at a very young age, I might say, to do that job. I loved it. And had a chance after that to become the executive director first of the Metro Detroit AHA, then the state of Michigan. Then I, in the 90s, kind of mid to late 90s, was asked by our national CEO to go to Massachusetts to become the executive vice president for that state, you know, highly focused on research and, you know, the work of AHA and clinical medicine. It was at the moment when our organization was contemplating consolidating from the 56 separate affiliates to one national organization with regions. And so my task at that time was to go help the medical volunteers in the state of Massachusetts recognize the benefit of that for the mission of the American Heart Association. And so in 1998, we incorporated, you know, we had the single largest merger in the history of New York State to this day, on this day. 56 corporations into one on the same day. And after that, I became the executive vice president of the Northeast region of the AHA, one of the, at that time, 12 regions. And then about a year and a half after that, I was asked to come to Dallas to be the chief operating officer in 2000, and I became the CEO in 2008.
Wow.
So that's a whirlwind tour of many years of devotion to the American Heart Association.
Well, that's amazing service to a great organization and a tremendous cause as well.
Thank you.
Tell us a little bit more about AHA now and the global reach that you have, the amount of people you have as a part of your team to impact heart health.
Sure. You know, it's a great time to ask that question. We're celebrating our 100th anniversary on June 10th, 2024. So 100 years ago, you know, the wise founders of the American Heart Association recognized there was a better way forward for people who were suffering from heart disease. And if I look back, you know, in the past 100 years and say, what an incredible sense of progress we have made with technology, new drug therapies, and really a better awareness of the public about their own health and well-being. Just an important fact to know, in that time, deaths from cardiovascular disease have been cut in half, you know, in that 100-year time period. So that's pretty incredible. So the AHA today is a large global organization. We have about 3,500 staff people, 40 million volunteers and supporters all over the world. We have 100 local divisions, we call them. We organize those into 5 regions. And those regions are really focused on the grassroots work of the AHA, fundraising programs, state and local advocacy, which is such an important part of what we do. Those regional heads, the executive vice presidents, report into our chief operating officer and are really a part of the fabric of the AHA. We have a presence in over 100 countries. We do quality improvement programs in about 20 countries. Our scientific journals, are widely read and distributed. We lead international CPR and first aid training in many countries, and we're a lead part of an organization called ILCOR, the International Liaison Committee on Resuscitation, where the guidelines are written for international CPR. So quite a large enterprise and growing every single day.
Yeah. And your 30-plus years there, you mentioned 100 years, but even in your 30-plus years there, the changes we have seen in the treatment and care of heart patients has been dramatic.
It's been unbelievable. There's this great slide. It's a Betsy Nabel, Eugene Braunwald slide looking at the death rate reduction from cardiovascular diseases from the 70s to like the mid, like 2018 or so. And they plotted across this graph an exact point of all the innovation in Medtech and in drugs, devices, medical technologies that happened during that time period. So like when statins went on the market, what happened? When people could do ablations for atrial fibrillation, what happened? And you just see this direct line of improvement in people's lives. And I think that's such a proud moment. And all of us at the AHA, and especially the scientists of the AHA, are so proud, to have been part of both helping to make those discoveries, but also making sure that those discoveries become part of the clinical practice guidelines that we write that really dictate the standard of care.
This is kind of a broad question, but how much of it do you think, how much of the improvement do you think is attributable to the technology, but also how much of it is attributable to the sort of early diagnosis of heart disease and the treatment thereof as a result of it that we've seen in the past really 30, 40 years, right? The ability to diagnose it so much earlier and then intervene has made a huge impact, I would think.
It's made an incredible impact. And, I could give you story after story after story of people that I have met who are passionate volunteers of the AHA who are like, thank goodness, my clinician was able to understand I was on this path to having a fatal heart attack or having a stroke. I think when you look at this interaction between the clinician and the patient and the types of tools that clinicians have for early diagnosis that were not here 20, 30 years ago. And they continue to improve now, certainly with AI-enabled technologies, home monitoring, telehealth, all of these things that allow people to become more involved in managing their care.
Yeah. So much of the work you all do must be to educate people on how to know if you're susceptible to heart disease, if you've got a history of it, and then what to do about it, right? How do you get the right treatments at the right time to prevent really, really bad outcomes, right?
That's certainly part and a very important part of what we do, and I can give you a couple examples. I think one of the most important things we have done in the past 20 years to improve the quality of life of people with cardiovascular diseases, including peripheral vascular disease and stroke, is our quality improvement program called Get With the Guidelines in 2,600 U.S. hospitals. That was a dream in our eyes about 24 years ago because we write the clinical practice guidelines, but we know that a guideline takes about 15 years to become fully incorporated into practice. And of course, those guidelines are based on the cutting edge information that comes out of clinical trials and science that shows benefit for patients. So we created a technology-based platform ourselves, a decision support tool in hospitals back, in the early 2000s that allowed clinicians at the point of care to understand the guidelines and understand the decisions they needed to make to treat the patient in the hospital and what they needed to discharge them on. And you fast forward 20 years, and just as an example, 85% of every stroke that happens in America happens in a Get With the Guidelines stroke hospital because we not only created that technology and the way to help educate clinicians, we went back up stream, and we changed laws in local states
Right.
that allowed EMS, for example, to bypass the closest hospital to take people to the
Okay.
certified
Yep.
stroke center.
Right.
But none of that matters if we don't have clinicians who are educated and technologies that allow clinicians
Right.
to do their job.
Right.
And none of that happens without great science at the beginning,
Right.
to help us understand what has to happen.
Yep.
I can tell you through the Go Red for Women movement, which is our focus on women and heart disease, story after story of women who will talk about early diagnosis,
Right.
that has saved them from having fatal heart attacks. And even today, women do not receive the same treatment if they present in an emergency
Right.
room. So we
Right.
have to have ways for early diagnosis of people.
Yeah, and it happens to be Women's Health Month.
Yes,
so it's a
it
good time
is.
to have this
Yes.
conversation, right? Why is it, do you think, that women have been overlooked, I think, in early diagnosis and also when they present with what appears to be a heart-related issue, overlooked by caregivers as well? Is there a reason for that, a history to that?
I think there are many reasons, and here's an important fact. It wasn't until the 1990s that women were even included in clinical trials. Now, women make up more than 1/2 of the U.S. population, and today, still, women are only about 30% of clinical trials, and our science advisory boards have very few women on them. So we go into this with a bias against women. I think that younger women who experience the warning signs of a heart attack or stroke, if they take their own symptoms seriously, present to an emergency room or to a clinician, and often their signs are dismissed because people have in their head that women aren't going to suffer, a heart attack
Right.
or aren't going to have a stroke, even, though the evidence is very clear that they do. And the types of heart attacks that women have are really fatal, like SCAD, sudden coronary artery dissection.
Right.
That's a very significant thing. Cardiac arrest, stroke, especially during pregnancy, after childbirth, and during menopause. Those are all areas where women are more susceptible. So we need more tools,
Right.
to help our clinicians have this early diagnosis of women who are at high risk for having an event.
Yeah. Are there things we need to do with government agencies, NIH, for example, FDA, CMS, some of the payers as well, to help them help us
Yes.
improve the clinical trial design
Yes.
so we get more women involved and therefore prevent these negative outcomes?
Absolutely. We need the government to do more.
Yeah.
Over the years, there's been a lot of talk and some action.
Yep.
More recently, I had the honor of attending the White House event where Dr. Biden and Maria Shriver and President Biden announced this new commitment to
Right.
women's health, a double-down effort both through ARPA-H and NIH funding on women's health, more representation of women in clinical trials. We just have to keep beating the drum.
Right.
I think that I can tell you a story without attribution. A very famous basic scientist saying to me once, Nancy, the problem is that women, the biology of women is very difficult. So if you're doing basic research with laboratory rats, it's very unpredictable. The state of the female, their biology at any given time to be able to have consistent outcomes. And I looked at him, I'm like, but isn't that the point? Like,
Right.
this is the point, that we
Right.
have to dedicate ourselves to understanding that women are not little men.
Right.
And women are having heart attacks, they are having strokes. It is the leading cause, cardiovascular disease is the leading cause of death in women.
Yeah.
We have to do more.
Yeah. What message would you give to women, professional women, a lot of whom might listen to this show, right? Who maybe have very high stress jobs, have
Yes.
challenges at home, have a lot of things that might attribute some of their symptoms to just stress, for example. What would you say to them about making sure they're doing what they need to do to protect themselves?
Yeah. Put yourself first on your to-do list. I think women often overlook their own health for the
Yeah.
benefit of their children,
Right.
their spouse or a partner or significant other, and for all the other responsibilities they feel in life. But it's kind of like the pilot on an airplane that says, put your own mask on first,
Right.
and then you can help other
Right.
people. If women aren't at their best, we can't do all the other things that we do. So put yourself first on the checklist. Know your health know your health score. You need to know your blood pressure, your cholesterol, your blood sugar. You need to get enough exercise. Don't smoke. Make sure your body mass index is appropriate. Know your family history. I was just with a famous geneticist yesterday, and we talked about the fact that so few of people have their genes sequenced, and since that isn't likely to change dramatically in the next couple of years, I asked her a question: what can people do? What should women do? And journal your family history. Have a conversation with grandmothers, aunts. Make sure like if you have people in your life that had heart attacks or strokes while they were young, like you are at higher risk. And that advice is for men or for women.
Yeah. During the pandemic, I hate to bounce back to the negative of the pandemic, but I suspect that got a little bit worse, right, for women and for everyone. When people weren't going to the doctor, they were staying out of areas where they might get treatment or care. Has that trend gotten better now? Are people back in to visit their doctors? Are they getting screened? Are they going for their physicals again, from what you can tell in the cardio space?
Yeah. That was, such a horrific moment, for so many reasons. And people were not presenting if they were having a heart attack or a stroke. Even those that weren't afraid to go to a hospital, had in some cases EMS systems that wouldn't transport them to the hospital.
Right.
And so at that moment, we launched a campaign called Don't Die of Doubt, helping people realize, like, don't die of doubt. If you think you're having a heart attack or a stroke,
that's great.
Get yourself to the hospital. We know during that time period, people did not keep their routine visits, even though there was a lot of progress made on reimbursement for telemedicine, as an example. People were not monitoring their risk factors. We had a lot of people gaining weight, not being as physically active. So the health of America, beyond the COVID-related specific deaths and outcomes, really went down. And we see this in the numbers that have been released over the past couple of years. Worse blood pressures, more people overweight, more anxiety, not shortening of length of life. We lost healthy life years during the pandemic. So we really have to be focused in almost over-indexing on making sure that people are hearing the message. You have to have a healthcare provider. You must take your health in your own hands. These things are very connected. A person's mental health and well-being is very connected to their physical health. And I think if there's anything we learned during the pandemic, it's the love of our family members and recognizing how important it is to be there for other people. And to be able to be there for other people, we have to have our health.
Right. Are you starting to see people respond to that now?
We are.
And getting to the doctor and staying engaged and taking care of themselves at home as well?
We are seeing it. We need to see more of it. I read a statistic recently about blood pressure control. And, of people who do not have their blood pressure controlled at our what we would define as the appropriate level of control, fewer than 20% of those people haven't seen a doctor in over 2 years.
Wow.
And so, it's important. And, I think we know clinicians are busy, but they care a lot about their patients. And I think that there's been a lot of progress made in terms of, more access to nurse practitioners, more access to telemedicine visits. There are ways that these visits can be easier. We have to have people taking action to take control of their health.
That's a good transition to the emerging technologies that are out there and the exciting things that are going on in this space. I had one of our CEOs on just a week or so ago. He runs an exciting new emerging company that has produced what is called nanoware, with tiny nanoware technology built into essentially a shirt that looks like you can then monitor your blood pressure 24/7 wearing that, as opposed to putting on the cuff and sitting for 5 minutes and breathing, and you get a much better sense of whether you've got a blood pressure issue or not.
That's right.
And intervention then becomes a lot easier if technology like that gets into the marketplace more quickly. That's one, but there are a lot of other exciting technologies in the medtech space. You probably see them from where you are to some degree.
Oh, yeah.
What are some of the things that you look at and you think, wow, this would be great, or we're heading in the right direction, or that technology is going to be life-changing?
Yeah. Let me just say, we are into this space in a very big way.
Yeah.
First of all, we have our own venture fund, Cardiation Capital. We have 12 investments into, these exact types of things, whether it's around blood glucose, cardiac rehab monitoring, continual blood pressure monitoring. All of those really matter to the AHA. And we also have a Center for Health Technology and Innovation, where we bring together clinicians and scientists with innovators, and we try to become resources scientifically and clinically for people who are starting companies or thinking about creating some of these devices. So we have about 40 companies that we're working with in the Center for Health Tech and Innovation. And we just this year in January officially launched AHA Ventures. So we intend to become even more active in this space, both in women's health, where we will be launching a women's specific venture fund. We'll still have cardiation, and we're creating a venture studio so that we can do some of this innovation ourselves. Because if you think of the AHA, we have the scientists, we have all the clinicians. I mentioned the 2,500 U.S. hospitals. We've got the grassroots. We've got advocacy, so we're very well positioned. We're really excited about these technologies, whether it's the blood pressure technology, whether it is technology that helps people, stay in tune with their health. I can, just talk about my own sister who has atrial fibrillation, and she's had 2 ablations in the past 6 months. And, now I've convinced her of the power of every day, doing her 5-lead EKG from home and making sure that the results get texted to me so that I can check up on her. Like, those technologies are life-changing. People can really have these early warning signs before something tragic happens.
Yeah. The Apple Watch is amazing, right? As an early indicator. I think KardioMobile is also fascinating technology with now the 6-lead, right?
That's right.
That you can do right on your leg, which is amazing as well. So many other new technologies that are emerging on the front end. But also on the back end of treatment, it's amazing what's happened there as well.
It is.
Right? Whether it's defibrillators or pacemakers or valves. I was just sitting with the company Edwards Life Science, who's got the amazing work they've done in TAVR, right, which is remarkable. But the progress in treatment is incredible too. Speak about that, the importance of it and the progress you've seen.
Yeah. Well, I will say that treatment is, it's unbelievably remarkable. You just think about all this innovation that's happening in treatment. It doesn't reach everyone everywhere, though. And, that's a very big focus of the American Heart Association, why we created these relationships with these U.S. hospitals and physicians in practice in communities. It's why we're very dedicated to making sure the guidelines get updated every year so that the state-of-the-art care is being delivered to people. Great companies, you mentioned several of them right there. They're on the cutting edge of innovation, but making sure that people that are practicing know about this innovation. That's part of what we do at AHA. We work very closely with Edwards Life Sciences as an example, and on aortic stenosis and helping to identify patients in the hospital through, our quality improvement registry, along with AI imaging, and how we can make sure that people who are at risk are having access to these treatments.
Yeah. One of the things we've talked about a lot recently is health equity. You've heard a lot of conversation about that in the political realm, right, in Congress and so forth. I've said a number of times, without access, you're never going to get equity. And oftentimes it feels like the clinical trials piece is incredibly important. I'm not going to take anything away from that. You've got to get that right. But at the end of the day, people need to get access to the healthcare system.
Absolutely.
And the healthcare system needs to give them access to the technologies in order to treat them. And so often it's the underprivileged or the poor or others that just don't have access to a good quality healthcare program that miss out on those opportunities as well.
Yeah, so. It's such a great point. I'm very proud that in 1993, the American Heart Association published its first policy statement on access to health care. And it's been a guiding part of who we are, especially in our policy work, but really in everything we do for decades. We're very dedicated to making sure that every person has access to high quality, healthcare
Right.
that delivers state-of-the-art care
Right.
to them. And we do things like, make sure that rural locations have the same access to technologies that we might
Yeah.
be implementing
Yeah.
as other places. As an example, right after the pandemic, you talked about the pandemic through a wonderful partnership with the administration and Admiral Brett Jawar, who was,
Yeah.
under,
I know Brad. He's
yeah,
a good guy. Yeah.
he got his first
Did a great
research
job.
grant from the American Heart Association.
Oh, did he really?
But I
Okay.
was talking with Brett one day, like almost every day during the pandemic, but I was talking with Brett about the risk factors. It's the same question you asked me. He's like, Nancy, what are we doing to help people? And I
Right.
said, well, you want to know what you can do to help us,
Right.
is we could help more people manage their risk factors if we could be sure that we got people's blood pressure under control. So in partnership with the Office of Minority Health, the American Heart Association launched a 3-year, very intensive program in the federally qualified health centers.
Oh, wow.
That's a place.
That's
We
great.
need these
Yeah.
new technologies to get to the federally qualified health centers. We need to make sure, that persons that live in states that have not yet expanded Medicaid,
Right.
that Medicaid expansion is part
Right.
of that focus. And we'd welcome you to join us in our quest to make sure that all 50 states expand Medicaid for things like women, postpartum Medicaid coverage,
Right.
Medicaid coverage for individuals having access to specialty care. All of these are things that are part of the fabric of what
Yeah.
we do at the American Heart Association.
Yeah, that's wonderful, and we will join you in that. I have said this a number of times recently in sort of off-the-record conversations. I guess this is actually on the record now. But there's been so much of a focus in the past 10 or so years about the need to bend the cost curve
Yes.
in healthcare. And while I understand that academically,
Yes.
right, if you bend it too hard, it's not the rich and the healthy who are going to suffer,
That's
right?
exactly
It's
right.
the poor and the unhealthy.
That's right.
It's the sick and deprived. It's
Right.
the people who don't have access to the healthcare system. And I wonder sometimes if it's time to challenge that notion, that maybe we don't need to bend the cost curve so much. We need to focus on giving more people access to better technologies and better healthcare systems so they can live longer. It's good for the economy. It's good for people. It's good for patients. It's good for families.
Yeah.
And maybe we need to have a different conversation about healthcare rather than just about cost. I don't know if you all have thought about that or you want to react to it, but
Well, we think a lot about value.
Right.
That's what we think about is how can we make sure, of course, we believe, and you look at anything the AHA says, it will start with every person deserves an equal opportunity to high quality health care.
That's it,
And
yeah.
we believe that. And behind the words high quality health care, of course, is evidence based
Right.
and new technologies that we write about in the clinical practice guidelines. Like
Right.
there should be no difference in in who gets access to that. And it's affordability is part of the equation. Like look what's happening with the GLPs right now.
Right.
And there's a lot of question about how all of that will get paid for, and we keep saying don't leave people behind.
Right.
We cannot leave people behind. And so what we try to do is model new approaches to healthcare delivery.
That's
As
good,
an
yeah.
example, I can talk about food. I know that's not necessarily in your bailiwick, but I'm
It's
sure
in
you're
everybody's.
interested in
Food's
food.
in everyone's
Yeah,
bailiwick,
I know.
yeah.
We all love to eat. But, we have a large-scale initiative that the American Heart Association and the Rockefeller Foundation are leading on creating the definitive evidence to prove that if food were integrated into the healthcare system and reimbursed like medicines are reimbursed or
Interesting.
procedures or
Right.
devices, that we could improve health and reduce costs.
Right.
That work is being led by Dr. Kevin Volpe from UPenn, who is both a clinician but also a behavioral economist at the Wharton School. We've been talking about how we could use that food as medicine approach
Right.
with the GLPs. Like, what if you had a wraparound,
Right.
that included not just the medication but access to healthy foods, and you could demonstrate behavior change over a long term? Then it becomes valuable.
Yeah, yeah.
It becomes valuable. So I think what we have to do is get creative about how we're creating evidence to show that things add value for the long term, for the healthcare system,
Right.
for the people who are receiving it. And when things are valuable, they will become easier, I think, for people to understand why they need to be paid for.
Yeah, you're definitely right. And that concept of food as medicine is so important.
It's so important.
For years, we never thought about food other than to fill yourself up or for
Yeah.
fun, right?
Yeah.
It seems like, right?
Yeah.
But we know so much more now, the
Right.
science of food and the nutritional value of different things.
That's right.
The impact of bad food on your heart,
That's right.
but also on your metabolism more broadly, in so many different areas. That's something we all, I think, need to work better toward.
Absolutely.
Healthier diets results in better health outcomes, and there's really no question about that now, right?
There's no question. And let me just say, access is an
Yeah.
issue with food as well.
For sure.
You know, we know that food companies, largely fast food companies, you know, they, just like tobacco companies, target, you know, persons of color and LGBTQ youth to begin a lifelong addiction of smoking.
Right.
You know, you look at where our fast food you know, restaurants placed. The largest proportion of fast food restaurants are placed in lower income communities. And,
Right.
you know, if you're a mother, you know, that has so much money to spend a week on feeding your family, you know, you go where you can get a meal that's
Right.
going to make people full. And we know for patients, especially if someone has heart failure, existing coronary disease, like having a healthy diet is a huge
No
part
question.
of making sure that a person, you know, can prevent the risk of having a fatal heart attack, having a stroke. And so we have to find models where food can be integrated into the healthcare system and paid for people who are at high
Yeah,
risk.
that's fantastic. So let's go back to the American Heart Association for a minute. And for all those who are listening to this podcast that are in the medical technology space, if they wanted to work with you or partner with you, how can they be in touch with those in your association, and where can they engage?
Yeah, well, we welcome involvement with partners always, and we're very proud of partnerships we have with many of your companies,
Right.
as a matter of fact, that are members of your organization. I think the best place to begin to engage is in the Center for Health Technology and Innovation. It's
Okay.
a great front door into the American Heart Association, a great place to kind of see what we're all about. I think that you know, we couldn't be more excited about the innovation happening in the marketplace, and we look forward to ways to continue to bring that to market.
Yeah, that's great. So I always like to close out the interviews with a few questions that are a little off script, sort of a
Okay.
speed round, right? I think you had a signature 5 that
My
you did.
signature 5, that's right.
This is my signature 4.
Okay.
How's that? So we'll end on that note. So what's your favorite or your most influential book you've read?
You know, it's so funny. At the time, it wasn't funny, but it is interesting. After my mother passed away, we were cleaning out, you know, reorganizing things for my dad and cleaning out bookshelves, and I came across this book that had been my grandfather's. My grandfather was a very influential surgeon. You know, he ran a MASH unit in World War II, and it was in my mother's collection of items of his.
Right.
And it was a book called The Magic of Believing, and it was signed by the author. It's a book from the 1940s, believe it or not. I have the original copy of this book. And, you know, when you read this book, it's all about how your mindset determines how you show up, how successful you are, how people relate to you, and how you relate to the world in a 1940s kind of way.
Right.
But it really has had an impact on me in my life. And, you know, there's a lot of, quote, self-help books, you know, one a minute, you know,
Right.
these days. But this book is a classic
Yeah.
because it really isn't about, you know, buy this thing or meditate this way or eat this way or whatever. You know, it really is a fundamental thing about the power of how you approach the world. And so
Right.
that is my all-time favorite.
Okay.
I cherish that original copy of my
Right.
grandfather's.
Well, that's neat. Now,
Yeah.
Jim, we have to get a copy of that and read it and share it with the team, right?
Yeah.
So we've started sharing books
Oh,
with
good.
the entire staff of our team, about 100 people here, and have established a book club recently as well. So
Excellent.
they read books together, and we've been working through some. That one would be very good, I think. So, your favorite president and why?
Yeah. You know, I have to say Abraham Lincoln.
Yeah.
You know, and it goes back to the team of rivals, right?
Yeah.
You know, being willing
book,
to bring people with different beliefs around the table. I feel like this is what I do with the American Heart Association all the time. You know, we represent every single person in the world that has a heart and a brain. Like, we are there to make the world a better place for people, and recognizing that everyone sees the world in different ways. You know, the magic of having a strong and impactful organization is being able to listen and incorporate people who aren't all the same and who don't all think the same. So I always admire that about President Lincoln.
Yeah, that's a great choice. And then if you could have dinner with one person alive today or from the past, would it be Lincoln or would it be somebody else?
You know, I'd love. It wouldn't have been interesting. I don't know that I'd want to have to wear the, you know, outfit and the corset and all of those things.
It would be a fascinating dinner.
That might not be mine. You know, I think Warren Buffett. You know, you know what I love about Warren Buffett? You know, what a successful human being.
Right.
But the most humble, down-to-earth person.
Right.
You know, I've had the opportunity to briefly meet him. I don't, you know, I've never had more than a, you know, 3-sentence conversation with him. But I would love to learn from him. You know, I'd love to know how he makes the choices he makes. He's surrounded himself with great people. He clearly has great values. You know, what's important to him in his life? It's his shareholders for sure, but, you know, the man still lives in the same house he lived in 30 years ago, and you know, nothing he has accomplished has gone to his head. I'd just love to learn more from him.
Yeah, that's a fascinating one. That would be a great
Wouldn't
dinner.
Wouldn't that be a great dinner?
It would be a great dinner. So, as you look back at your life, or maybe just your career in this case, what's the most important success you've had and the most important failure? Yeah. And kind of how's that shape your leadership?
Yeah. You know, that's a interesting and often asked question in forums like this. You know, what I like to say is every day I think all of us have successes and we have failures, and what's important is to learn from them all the time. You know, I can think of times, you know, great successes, you know, consolidating the American Heart Association from 56 affiliates into the 5 regions we have today, making our way through, you know, I think in my life a question I get asked, especially from young women who would like to be a CEO, like, wow, you know, what have you learned over time? You know, to me it's always relationships matter. I think of successes, you know, do you remember where you were at 9/11?
Right.
You know, the crash of the stock market in 2008. The day the market went the lowest to 6,600 was the exact day the reins were turned over to me to become the CEO of the HA. I'd been the COO, right? But, you know, so that wasn't a failure. That was a challenge, you know, and along the way, we tried things. Some of them worked, some of them didn't work. But from everything, whether it's the biggest success or the biggest failure, you know, I always hope that I remain willing to be a lifelong learner. Why did that work? Why didn't that work?
Right.
And how can the team, you know, continue to thrive?
Yeah, it's a great answer. I had a friend of mine who said, if you want to be successful, you have to learn how to fail.
Yes.
And if you learn how to fail, you're going to be successful.
That's right.
And I've always thought that comes in many different forms, so you can't fail too much, right?
Yes.
But it's really true, right? It's a little bit about risk-taking and understanding how to manage that when you're successful and when you're not.
I could give you a list of things that have blown up in my face,
Yeah.
but, you know, you can't let it hurt your spirit.
Yeah.
You know, you just can't. You know, at least in my business and in yours as well, like, we're saving people's lives here.
Right.
You know, so what? We tried to create this new technology in 2012 that was before its time, and it, you know, didn't happen. Okay, it didn't happen, but guess what? You know, you come back around, you learn from it. We made relationships there that helped us in future things. It's, you know, it's all, you know, every day just stay focused on the vision and never forget the people that we're here to serve.
Yeah, great advice. Just really great advice. Well, thank you for coming on.
Thank you.
And thank you for your service to mankind.
Thank you.
And the work that the American Heart Association is doing. And on behalf of all of our companies, we're grateful for that too. So many in the cardiovascular space. And the partnership with organizations like yours and the leadership you've shown has been really, really remarkable. And so we wanted to take a minute to thank you for that, and thank you for sharing your thoughts, and congratulations on 100 years.
Thank you so much. And thank you for having me today, and many thanks to your companies, you know, who are out on the front end, front of the arrow, you know, innovating new solutions for patients. We are so grateful for that.
Good deal. Thanks again.
Thank you.
Thanks again for tuning in to the Medtech POV podcast. For more episodes, visit advamed.org/podcast or subscribe to Medtech POV on your favorite streaming platform.